Thanks for staying with us here on the Jaw News channel. You're still watching The Pulse. It's right now the time for me to take you to Parliament. The Health Minister, Kwabena Minta-Kando, is currently addressing the press. Please listen in. 25
for Paris, France, to participate in the 8th edition of the Paris Peace Forum, scheduled to take place from 29th to 30th October 2025. Following this engagement, I will depart Paris on 31st October 2025 for Cairo, Egypt, to attend the opening ceremony of the Grand Egyptian Museum on 1st November 2025. I plan to return to Ghana on 1st November 2025. In my absence, the Vice President, Professor Nana Jane Opoku-Agyeman, shall perform my duties in accordance with Article 68 of the Constitution. Signed, John Dramani Mahama. Honourable members, the Second Deputy Speaker to take the chair. Yes, Minister, I'm sure you heard the member loud and clear.
Mr. Speaker, since the Honourable Member is veering into figures, I do not have the figures available at the moment, and he may fire the appropriate question, and I'll come back with the figures. I don't have the figures available now.
Actually, he didn't say the cost. He said what goes into the cost. So we're looking for the ingredients, the various things that go into the cost. But if it's just how much does it cost, that is specific, then you can give that. But if you say what goes into it, it means you have to analyze and see the elements that come together to make the drug cost that much. I hope I got you clear.
Mr. Speaker, my question was in two phases. The first part of it was... No. The first part of the question... Allow. The first part of the question was very clear as to the cost. And the second part was to the analysis of the cost in respect of the health insurance. So that is the second part. So if the minister is telling that he doesn't have the figures and he will provide this house with the figures, it's a very valid answer. But if you say that question will have to come by way of substantive question, I beg to disagree, because it is directly flowing from the answer he gave to the honourable member, Honourable Mavis. So, Mr. Speaker, is it the response?
Be standing. This will be standing.
Yes. Honourable Minister,
This way you can also stand up.
are you saying you should be given time to come back or what?
Yeah, Mr. Speaker, I will make the cost available to the House.
Well. Let me go to Bimbila. No. Honourable Yindam.
Thank you, Right Honourable Speaker. Mr. Speaker, looking at the birth rates in this country and looking at the cost involved, which you admitted, what step is the ministry taking in between now and the first quarter to assist pregnant women who are unfortunately carriers?
Yes, Honourable Minister.
Thank you, Mr. Speaker. Mr. Speaker, immunization is a structured program under the ministry. And so we have a program for it. It was not part, and as I speak tonight, it is even not part of our immunization program, but as part of the free primary health care we intend to roll out, we are bringing that on board. So for now, we don't have any ad hoc measure to deal with it. We are taking our time, and we want to put it as part of the traditional immunization. So for now, we don't have any program for it for now. We are waiting for the substantive program we have planned.
Well. Yes. Honorable Isaac Boama.
I'll give you just a very short and simple one. Mr. Speaker, I think the question as asked the Minister is key because of the consequences of lack of immunization in that regard. And given the response of the Minister to the effect that the consideration for national attention would be done by the end of the first quarter 2026. I want to ask the Honourable Minister, if you look at the data, if you have data now on where it is endemic, I think there should be a structured approach to see how best you would resolve or make special finance. You've come to this House with special budget to deal with emergency situations. So I want the Honourable Minister to tell this House what special arrangements he has put in place from his budget. If really he has received releases from the Minister of Finance, and then make provision for the endemic places to be treated as a state of emergency. Thank you very much, Mr. Speaker.
Yes, Honourable Minister.
Thank you, Mr. Speaker. Mr. Speaker, I repeat, the Ministry has a program for bringing on board the Hepatitis B bed dose. And so I will indulge honourable members to be patient and we will enroll it. We didn't come to meet it at all, please, with the greatest of respect.
Thank you very much. Leader.
Mr. Speaker, according to the Minister, government will soon introduce immunization to save lives. But what I find curious is the fact that though hepatitis B affects a chunk of our population, in fact, Mr. Speaker, record from Ghana Health Service gives a data which is in excess of 1 million being infected, yes. And I've had, yes. I made a statement on this on the House floor. They estimate almost 10% of our population infected by hepatitis B. What is quite curious is the fact that the HIV/AIDS, we have this antiretroviral, and that is for free. May I know from the Minister, in view of the effort being made for the immunization to be free very soon, are there plans by the ministry to also add hepatitis B treatment to the category of HIV/AIDS? Because, Mr. Speaker, they all depend on the antiretroviral for treatment. And one effect of this hepatitis B is that it leads to liver cancer. And the deterioration is faster than the most feared HIV/AIDS. All over, people are suffering. And it's not only through sex that people get infected. Even sweat alone, the food. Yes, food, drink is there. Body contact alone can cause the infection. So, Mr. Speaker, can the Minister make that disclosure if there is any such plan?
Yes, Minister.
Thank you, Mr. Speaker. Mr. Speaker, my information is that it is very, very difficult to treat or to cure, if not impossible. But then when you get the symptoms, the National Health Insurance, as we have it at the moment, covers that. And it could be managed it could be maybe. That is why I'm saying that it is not curable. It's not, its treatment is very difficult as we stand now. And so, Mr. Speaker, having it as symptoms could be considered under the national health insurance as we have it at the moment. Yes, so when you have, every disease and its symptoms, you understand. And so, for example, if you go to the hospital and you have headache, and they try to manage the situation. And those situations are under the national health insurance as we have it at the moment. But to say we are treating or curing the hepatitis B on the national health insurance, that maybe I will have to recheck.
Speaker, with respect, I need to lay a good foundation for my respected colleague, the minister, to understand the situation. Mr. Speaker, when you get HIV and it is so tested and viral load is determined, the health authorities put you on antiretroviral drugs. It is free.
Honorable Leader, please address me.
It is free. Hepatitis B, and I want colleagues to pay attention to this matter because a lot of our constituents are being affected, and we need to push for government to take a position on this. The treatment and the management of hepatitis B is also done through the same antiretroviral drugs, but that one is not free. The same treatment, the same drugs that are used to manage HIV are the same drugs that are used to manage hepatitis B. And I'm saying that the data available at Ghana Health Service point to the fact that we have more Ghanaians being infected by hepatitis B than HIV. So there's a public health situation here. Unfortunately, the treatment of hepatitis B is not covered, as well as the vaccination. But the minister has assured us of the immunization bit. That one he has assured us that very soon. What I want to know from my respected colleague is that are there plans to put infected people also on the antiretroviral drugs for free? Because by the time the symptoms show, the person would have gotten to the advanced stage. Mr. Speaker, I have done an exercise in Winneba because when the data came out, it was so alarming, and a lot of those who were infected were saved by Safu Kantanka's drugs. He has some immune boosters, some liver boosters, and those who were on it, sometimes you go and test, and the viral load would have come to a very lowest level. Sometimes you cannot see it. It actually finds a way of getting out of your system, according to the data and the reports from the health professionals. But, Mr. Speaker, because we do not have free treatment, people get it, they go test positive, and liver infection, within 6 months, 8 months, a year, they lose it and they die. So, if the minister can assure us that government will take steps to make the treatment of this free, the better it will be for our population, especially when the mode of transmission is quite high. The way people get infected and all, it's not just one way. So it's a very important matter that our colleague Mavis has brought to the floor.
Thank you, Leader. So,
I didn't go to greet them.
Mr. Speaker, my information from the experts indicate that the sets of treatment to handle HIV is completely different from that which is used to handle hepatitis B. And therefore, the two cannot be the same, with the greatest of respect. And so, Mr. Speaker, if it is the humble opinion of the leader that we should rethink, we should relook at that which will handle hepatitis B, that's a different argument altogether. Maybe that one we may decide to reflect on it. Thank you.
Very well. Yes, leader.
Mr. Speaker, this period is not for debate, but once the minister put out some facts, it is important that a question is put for clarity. According to our respected colleague, the minister, he says that according to some experts, the treatment or the management of hepatitis B does not use, I use the word antiretroviral.
Honorable members, we don't need to spread our heads in this. He is on the floor. If you have a question, you can pose. Don't worry. Let's allow him. Yes, leader, please. Let's.
Mr. Speaker, is the minister in his answer telling this House that the treatment of hepatitis B
Leader, please address me. Don't just address the chair.
Is the minister saying that the treatment of hepatitis B does not rely on antiviral medication? Is that what he's saying? Mr. Speaker, that's my question. Mr. Speaker, I said, Mr. Speaker, with respect, I said, please, Mr. Speaker, this is a serious public health issue. That's some of the mistakes we make as political leaders. People in our constituents are dying. The percentage, the infection rate, according to Ghana Health Service, it's about 10% of the population. That is an alarming figure. So if we are talking about 30 million, over 3 million of our populace are infected by hepatitis B, far higher than HIV. So let's not be partisan about this. What I'm saying is that in HIV, they rely on antiretroviral for treatment, and it's for free. So today, unlike some 20 years ago where people get HIV and they die, today, because of the management, the antiretroviral, people are able to take it religiously, manage their viral load, and they live a healthy lifestyle. I am saying that in the case of hepatitis B, which kills faster and leads to liver cancer, and the time you realize it, your liver would have been gone. Vaccination is not for free. For adults, treatment is not for free. Meanwhile, it affects the population in higher numbers than the HIV that we fear. People are surviving more on HIV than hepatitis B, and they are dying quietly. All I want to know from you, Honorable Minister, is that would you take steps to put hepatitis B treatment on the National Health Insurance Program and make it free as well?
Well.
Thank you, Mr. Speaker. Mr. Speaker, that will be considered. Thank you.
Well. Thank you. We turn to question 7B. Question 7B. And the question stands in the name of Professor Titus Kofi Bayo, member for Lambusi. Honourable member, I have the floor now.
Thank you, Mr. Speaker. Mr. Speaker, I rise to ask the Minister responsible for health practical steps taken by the ministry to ensure decentralization of interventional radiological services in the country in order to curb preventable deaths from diseases like stroke, heart attacks, and other acute medical conditions. Thank you.
Thank you very much, Honorable Minister.
Thank you, Mr. Speaker. I thank the honourable member for this important question, which highlights a critical component of our national strategy to reduce preventable death from cardiovascular and other acute medical conditions. Mr. Speaker, interventional radiology is a specialized branch of medicine that uses minimally invasive, image-guided techniques to diagnose and treat various medical conditions, including blocked blood vessels, internal bleeding, and organ disorders. It plays a vital role in the rapid management of emergencies such as stroke, heart attack, and other life-threatening conditions. Mr. Speaker, the situation inherited by the government was that only 2 public facilities were providing some level of interventional radiology and cardiac catheterization services. In addition to few centers operating within the private sector, this limited distribution of services constrain equitable access and contribute to delays in the management of cardiovascular and emergency cases. To address this gap, the Ministry of Health, in collaboration with the Ghana Health Service and other implementing agencies, the National Ambulance Service, and other development partners, has adopted a comprehensive plan to expand interventional and emergency services nationwide. First, in the area of capacity building, the ministry has partnered with the Ghana College of Physicians and Surgeons to establish a fellowship program, Interventional Radiology. Funding and scholarships have been secured to support training with attention to equitable regional representation. Continuous professional development programs have also been revised to include interventional techniques for radiologists, cardiologists, and emergency physicians. Additionally, telemedicine platforms are being deployed to provide mentorship and technical support to regional hospitals. Second, regarding infrastructure, the ministry has prioritized the expansion of interventional and cardiac care facilities. 6 regional hospitals are being upgraded over the next 2 years to include CT-guided intervention suites and portable ultrasound system for emergency vascular procedures. The Speaker, most notably, we have set in motion processes for the establishment of 3 new catheterization laboratories, known as cath labs, in selected tertiary hospitals to support interventional radiology, cardiac procedures. This represents a major advancement in the equitable distribution of advanced cardiovascular care. Our targets include increasing the number of certified interventional radiologists from 4 to 20, establishing functional IR services in at least 6 additional regions, and reducing the median door-to-procedure time for acute stroke and coronary syndromes to under 90 minutes. Finally, Mr. Speaker, sustainability is being ensured through the integration of IRA-related maintenance and consumable costs into the National Health Insurance Scheme, and by progressively expanding local training programs to develop a fully Ghanaian faculty by 2028. Mr. Speaker, the Ministry of Health remains firmly committed to decentralizing interventional radiology and cardiac intervention services as a key element of our national health strategy. Through targeted interventions in training, infrastructure, including the establishment of 3 new cath labs and strong partnerships, we are ensuring that life-saving, minimally invasive procedures become accessible to all Ghanaians, regardless of their region or residence. Thank you.
Thank you very much. Honorable Professor Bayoni, supplementary question.
Yes, Mr. Speaker. Thank you. Mr. Speaker, I asked this question because not too long ago, we lost a colleague, medical doctor, who needed catheterization in the Ashanti region and had to be flown to Accra. So my next question is...
Member, when you say catheterization, what do you mean?
That's what the minister talked about. It's an interventional radiological procedure that they can, through a wire, guide into the vessel to remove a clot. So he had a clot in the blood vessel and it was blocking supply of blood to critical part of his heart.
Okay.
And as we speak, this service is not available in any part of the country outside of Accra. And so even from Konfanochi, the person could not make it to Accra and passed away. So there are people from my constituency in Lambuse, people in the Upper West region, the northern regions, who want to hear from the minister. How soon can these catheterization labs be made ready in other parts of the country? But while at it, I commend the ministry for a comprehensive package to decentralize these services so that Ghanaians everywhere stand a chance of surviving if they have an acute event. But I want to know how soon can these labs be established. Thank you.
Yes, Honourable Minister, how soon?
Thank you, Mr. Speaker. Mr. Speaker, as a matter of fact, government is at the concluding stage of the procurement processes. And therefore, I can assure you that very soon, 3 of the catheterization or cath labs will be established across various locations in the country. The difficulty, Mr. Speaker, is that it is my information that these equipment are not manufactured and put in the showroom for sale. It is based on order, and that's the difficulty. So we are at the concluding stage of the procurement process, and I can assure you very, very soon it will be ready.
Thank you very much. Yes, Honorable Dr. Kabilu.
Mr. Speaker, I'm not a medical doctor. And Mr. Speaker, I provide this disclaimer because I'm following from the response the minister gave. Based on the background of this issue and the agency of that particular matter and the seriousness of that matter, I'm sure the minister will not be content in himself to say that very soon, without definitivity, without certainty, without as to very clear timelines. Even procurement has timelines. Mr. Speaker, I'm sure the people of Lambuse will not be happy with the minister's response that very soon. And the question was, how soon? And the response was that very soon, Mr. Speaker. I mean, that should not stand as an answer in this particular house. We want the minister to provide, just like he provided us in the case of Hepatitis B, first quarter of next year. We want that certainty so that people can plan their life around that. And that is specifically the answer we are looking for. How soon? We want definite timeline, Mr. Minister. Thank you very much.
Yeah, Honorable Minister. Personally, until your explanation, I never knew that this is a very important question. So I share with Dr. Kabilu if he can give us specific times.
I entirely agree with you. It's an issue of emergency, and His Excellency the President has given clear directives, and that's why I told the House that we are at the concluding stage of the procurement. But Mr. Speaker, I've been following the development keenly, and just to share with you, I've already indicated that it is not manufactured and put at the showroom. It will take not less than 2 to 3 months to get the machine fully manufactured. And it's not being manufactured in Ghana. It will have to be on the sea to travel into the country. Give yourself about 1 to 2 months. And so if you add, give or take, we are talking about not less than 5 months. And so, but I didn't want to, Mr. Speaker, but that is the explanation, Mr. Speaker.
Yes. So we will now turn to the normal questions. We will turn to the normal questions, and we will come to Dr. Kingsley Ajimai, member for Buakwa South, on question listed as 86. Dr. Ajimai, you have the floor now.
Thank you very much, Right Honorable Speaker. I seek to ask the Minister for Health what approach the ministry is taking to coordinate data collection, analysis, and dissemination of research to generate evidence-based health policies. Thank you.
Yes, Honorable Minister.
Mr. Speaker, I thank the Honourable Member for the question, which highlights the importance of data governance and research in shaping evidence-based health policy. The Ministry of Health recognizes that the healthcare is data-intensive sector and that timely, accurate, and secure data are essential for sound policy and effective service delivery. To this end, the Ministry is implementing a comprehensive strategy to strengthen coordination in data collection, analysis, and use across the health sector. First, we are automating data capture at all levels of care to replace manual entry, reduce errors, and ensure timely reporting. This digital transformation enhances accuracy and efficiency while freeing health workers to focus on patient care. It also ensures that our systems are robust, interoperable, and locally managed, so the ministry maintains full control of medical data without dependence on external vendors. Second, we are establishing a national health database under the Health Information System Strategic Plan to integrate data from the Ghana Health Service, the National Health Insurance Authority, and other agencies into one reliable repository for policy, planning, and research. Third, we are harmonizing health data and metadata across all 29 agencies to ensure consistency and interoperability, and are collaborating with the Ghana Statistical Service to align health data with national demographic information for more accurate analysis. The ministry is also partnering with universities and research institutions to apply advanced analytics and big data tools, enabling real-time insight for planning, resource allocation, and performance monitoring. Complementing this is a knowledge translation platform, which ensures research findings are systematically synthesized into national policy recommendations. Mr. Speaker, through these efforts, the ministry is building a modern, secure, and integrated health information ecosystem that supports a real-time decision-making, safeguards data sovereignty, and reinforces our commitment to evidence-based health policy. Thank you, Mr. Speaker.
Thank you very much. Yes, Dr. Ajimai.
Thank you very much, Minister. I might have mixed it. Forgive me if I did. My question was in threefold: collection, analysis, and dissemination. Dissemination is very key, but in your response, I didn't hear a response on dissemination of this data. Can you please point to the various paragraphs that answers the question on dissemination? Thank you.
Yes, Minister.
Mr. Speaker, if the Honourable Member will come again, dissemination as in the analysis we get from the data gathering, what we learn from it, and disseminating that information, or what do you exactly mean by dissemination?
Thank you very much. You have collected data, you've analyzed data. How do you disseminate that data to transform into policy evidence or evidence policies that will require in the health sector? Thank you.
Yes, Honourable Minister.
Mr. Speaker, what data does to policy is Mr. Speaker, I'll give you a practical example. It's out of data that we realized that about 43 to 45% of our mortalities in this country are attributable to NCDs. It's data. So once you have this data, as a government or as a leader, it informs your policy, hence the establishment of Mahama Cares, to deal with the issues. And so when you know that there is a problem out of the data, maybe in some cases, in some cases, you have to embark on sensitization drive. How you sensitize the people to, maybe if it's for example, if it's an outbreak, if you have a data on outbreak, then you have to roll out your public health strategies to sensitize the people on how they can prevent themselves from that particular outbreak. And so that is how the analysis or the data collection informs decision makers to be able to govern well. I thank you for the opportunity.
Yes, no.
Thank you very much, Right Honourable Speaker. I think I will engage further on the response given on the dissemination. I have a quick follow-up. Again, in consonance with BEC's global practices, you realize that research calls are usually announced so that we reduce biasness and other issues that comes with it. The response, however, was lacking on mitigating strategies to reduce biases to research. Can the minister consider such issues that are usually in line with best practices when it comes to research calls? Thank you.
Yes. Is there a question or you?
So, no, it's not an admonishment. The question is, what strategies have they put in place to mitigate research biasness with regards to usually best practices on research calls?
Yes, Doc. Honorable Akando.
Yeah, Mr. Speaker, there are various platforms for, if you like, advertising or disseminating the outcomes of research. And for me, every research has a reason. You have a target. If the target at the end of the day is to create some kind of awareness, at the end of the research, you do so, given the aims for the research. But if the research is also to guide you to take certain decisions, you also do accordingly. But that notwithstanding, your issue of best practice is also taken on board. And usually we use platforms like the Health Summit, the WHO, Health Assembly, and then other avenues or other fora to do this dissemination. Thank you for the opportunity.
Honourable members, let's turn to question 9.5. Question 9.5. And the question stands in the name of Honourable Member for Old Tafo. Oh, you wanted further questions? Okay, then let me give it to Ofolukrum. Dr. Kabiru is spoken a lot. Let me give it to Ofolukrum.
Thank you very much, Mr. Speaker, for this opportunity. Mr. Speaker, I want to ask a question as a follow-up to the answer given by the Honourable Minister. The Minister stated that the data that is captured is very relevant to the health sector. But currently, I'm privy to information that the National Electronic Medical Record System is down. So if the National Electronic Medical System that captures all records of medical issues is down, how are you capturing the data? How are you able to store the data and even access and use that data for the benefit of Ghanaians?
Very well. Honorable Minister. Yes, Honorable Minister.
Thank you, Mr. Speaker. Mr. Speaker, it is true that we have some challenges with regards to our patients' electronic records. Mr. Speaker, I can assure you that tomorrow I'm going to address the whole country to tell the whole country what we have inherited, what we are going through, and most importantly, the solution. And so I can assure you that it's not going to block or hinder the collection of data at all in any case. It will not. Thank you very much.
Very well. So we turn to Dr. Kabilu. Doc, he's your friend though. I'm saying Akando is your friend. Okay, let's hear you.
Mr. Speaker, I am rather difficult because yesterday at a TV program, it was a serious issue on the issue of the contract between the Minister of Health and the Lightwave Health Information Management System. The fact that we are now going back to manual system of collecting data, that after an initiative by the previous government to digitalize our data and to contract to ensuring that we have electronic collection of patients' data for the purposes of coordinating and informing evidence-based health policies, we are now back to that era. And that's the reason why I want the minister to rather take this issue more importantly now, because the members of parliament are here, the representatives of the people are here. And if he's going to organize press conference somewhere to address them, I'm not sure I'll be at the press conference, and I'm not sure how I'm going to tell the people of Wale Wale how the minister is addressing this issue. Mr. Speaker, the fact is that these people have not been paid their money. What measures is the minister putting in place to pay them their money so that they can bring back their service? Mr. Speaker, this is my question to him.
Thank you. Honorable Minister, he's saying this is the biggest platform you can have. So
Mr. Speaker, I agree.
Yes.
I will take up the challenge.
Yes.
So hear me. Mr. Speaker, in 2019, Ghana government signed an agreement with a company called Lightwave. Mr. Speaker, the contract sum was $100 million to connect 950 health facilities in the whole country. And the contract was supposed to expire in 2022. Mr. Speaker, in 2022, the contract was extended twice to expire on the 31st December 2024. Mr. Speaker, at the end of the 2024, out of the 950 facilities, only 450 had been connected. Out of the $100 million, $77 million had been paid. More than 77%. Meanwhile, less than 50% of the job had been done. Mr. Speaker, as part of the contract, it was supposed to be divided into what we call milestones. And so at the end of each milestone, the infrastructure and everything must be handed over to the states. Mr. Speaker, it is unconscionable for any government appointee to sign an electronic agreement that an individual will be hosting our data and the state will not have access to our data and the state will not have access to our service. Our health data. Mr. Speaker, this is what we inherited. Mr. Speaker, at the end of the 2024 when we took office, in 2025, the contract had expired. And so the issue of the government has come to terminate any contract doesn't arise, Mr. Speaker, because the contract actually expired on 31st December 2024. So there was no issue of termination. Mr. Speaker, when we took office, as part of the contract, we said, hand over whatever you have done to the state. And before we sit to take delivery of whatever has been done, we needed as a ministry, as a government, to know whatever we were inheriting. And so a forensic audit was conducted, Mr. Speaker. Mr. Speaker, as part of the forensic audit, what we realized was that the software, the hardware, the infrastructure alone, there were gaps. For example, it was stated in the agreement that supply HP laptops. You go to the facilities and a different brand has been supplied. Supply 20 and you go to the grounds and less than 20 has been supplied. So there were issues of quality and there were issues of quantity. Gaps. Mr. Speaker, the gaps alone, when analyzed, was over $18 million for the hardware. That was the gaps. Mr. Speaker, it will interest you to know that in the next milestone, Ghana government paid more than $10 million to the vendor. And he was supposed to connect about 157 facilities. Mr. Speaker, guess what? Only 7 was verified. 7. 1, 2, 3, 4, 5, 6, 7. Mr. Speaker, after all this, we said that, look, because we don't need any disruptions, we were ready to sign another agreement because there was no agreement, there was no contract. Because of the software, Mr. Speaker, it doesn't also make sense for the country's data, the software, to be owned by an individual. So we are ready. Let's sign a license renewal agreement for 2 years. Mr. Speaker, the vendor indicated that in the agreement, he doesn't want to hear anything about data. Yes. Mr. Speaker, the vendor again indicated that we should write as part of the contract that we, the ministry, have verified 461 instead of 450. Mr. Speaker, there and then, as ministry, we had to put our heads together to find solution to the matter than lamenting. Mr. Speaker, so, honorable members, the good news is that I've shared with you the challenges we have inherited, where the medical records, the electronic medical records, was being hosted by an individual, where the country didn't have access to our service. But at the moment, Mr. Speaker, we have the solution, and we are rolling out in the whole country. We have a 4-week plan. In the first 1 week, next week, we are rolling more than 100 facilities. The third week, more than 100 facilities. And, Mr. Speaker, I can assure you, with the shortest possible time, we'll get all these 450 facilities covered. Mr. Speaker, what this vendor was doing to the state was that as and when he demands what, then you switch the thing off. And Mr. Speaker, for your information, the data, the server doesn't even sit in Ghana. It's far away in India. Yes, far away in India. Mr. Speaker, we are religiously guided by this contract, and we'll put in place the necessary solutions so that we'll prevent the reoccurrence of the mess we have inherited. Mr. Speaker, tomorrow, as I've already indicated, we'll give a full presentation on these issues, pictorial evidences, and we'll also tell the people of this country what we are going to roll out. I thank you for the opportunity.
Thank you very much. We turn to question 95. Dr. Kabilo, you didn't own the question. I gave you the opportunity to ask supplementary question. And the question has even revealed some of the information, because you insisted this is the biggest platform, and he alluded to that. So let's move on. Question 95. And the question stands in the name of Honorable Vincent Asefua Oltafo.
Thank you, Mr. Speaker. In accordance with Order 883 of our standing orders, I rise with authority from the Honorable Vincent Eko Asefua, Member of Parliament for Oltafo, to ask the Minister for Health the timeline for the completion of the maternity block at the Tafo Government Hospital. Thank you.
Yes, Honorable Minister.
Thank you, Mr. Speaker. I wish to inform this august House that both executive and parliamentary approvals were duly secured for the financing and supply contract related to the Tafo Maternity Hospital project. Additionally, value for money negotiations were successfully concluded. However, Mr. Speaker, as you may recall, in January 2023, the government, through a circular issued by the Ministry of Finance, suspended payment on external funded projects. As a result, the Dutch Bank AG, the project financier, was compelled to halt the necessary processes required for project effectiveness. Consequently, the project has been temporarily put on hold due to the debt restructuring. I thank you, Mr. Speaker.
Very well. Yes, Honorable Gloria, any supplementary question?
Yes, please. Mr. Speaker, has the Ministry of Health engaged the Ministry of Finance to find a new funding or support to complete the Tafo maternity block and other health projects?
Yes, Honorable Minister.
Mr. Speaker, we are still pursuing the same source of funding, but it has to do with the debt restructuring. And so as and when we sign the bilateral agreements with them or conclude on the restructuring, we think that we've not hit the rock yet to be able to change course. It is due to the debt restructuring, so we are still pursuing the source of funding. Thank you.
Thank you very much. Yes, Honorable Gloria.
Mr. Speaker, what temporary steps has the ministry taken to reduce overcrowding, lack of staff shortage at the Tafo Government Hospital, where the maternity block remains suspended?
Yes, Honorable Minister.
Mr. Speaker, I thought we were talking about construction of maternity. We are now veering into the issues
members, please allow
issues of recruitment of workers and what have you.
But he's talking about
overcrowding.
Overcrowding, yes.
Mr. Speaker, what I can assure the honourable member is that we have a program for that facility, and we'll go according to what we have, the program we have. Thank you.
Thank you very much. Yes, Gloria, I'll give you last.
Mr. Speaker, please, I want to find out with the minister that how soon?
Yes, Honorable Minister.
Very soon.
Honorable members. Yes, leader.
Mr. Speaker, with all due respect to the minister, I think the answer he has provided is completely inadequate. Minister, you can do better. So please kindly just respond to the question. But your response,
Minister,
is inadequate.
The leader is your friend. Look at
so, Minister, Mr. Speaker, he's my former friend, so he should be able to.
Speaker, this house is a house of records, and I don't expect my colleagues want me to lie to the house. This project is dependent on the conclusion of the debt restructuring. I must know when the debt restructuring will end before I can tell you when we can even have access to the source of funding. So, Mr. Speaker, we are pursuing it, but with the greatest of respect. I do not want to be called to appear before the Government Assurance Committee, and therefore I am being very careful here.
Thank you very much. Honorable members, this is a constituency-specific question, so we will not rule out any supplementary question to any member. So we turn to question 262. 262. Honorable Member for Suhum, Honorable Frank Asiedu-Bequin.
Thank you, Mr. Speaker, for the opportunity. I will arise to ask the Minister plans the ministry has for the expansion and refurbishment of the emergency ward at the Suhum Government Hospital.
Thank you very much. Honorable Minister, Suhum Government Hospital.
Mr. Speaker, thank you for the question. The Ministry fully acknowledges the essential need for a well-functioning and adequately equipped emergency ward at Suhum Government Hospital. At present, the expansion and refurbishment of the emergency ward has not been captured under the 2025 fiscal year budget. However, the Ministry intends to undertake a detailed assessment of the facility to determine the scope of work required. Based on the outcome, the project will be considered for inclusion in the capital expenditure program in the near future. Mr. Speaker, I wish to assure this August House that the Ministry will prioritize this intervention to strengthen emergency healthcare services for the people of Suhum and its surrounding communities. Thank you.
Your choice of words, in the near future. Meanwhile, 2026 budget is coming. Why don't you say 2026 budget? Anyway, honorable member for Suhum.
Mr. Speaker, nobody should think that that facility belongs to only Suhum people. Because if you travel from Accra to Kumasi, you pass through Suhum. Those from Akosombo, Koforidua, going to Winneba, Cape Coast, they pass through Suhum. So between January 2025 and September, we've had 263 reported accident cases in Suhum. So I want the minister to assure us if he's going to fast track his assessment of the situation in Suhum, because the Suhum Government Hospital serves a lot of people, including people who live outside Suhum. Can the minister assure us of some assistance?
Yes, Honorable Minister. He has given the importance of Suhum Hospital.
Thank you, Mr. Speaker. Mr. Speaker, I wish to reiterate some aspect of my response. And I quote, the Ministry intends to undertake a detailed assessment of the facility to determine the scope of work required. Based on the outcome, the project will be considered for inclusion. So, Mr. Speaker, I think what the honourable member needs to do is to work with the Ministry so that we can assess the situation and see what we can do. Thank you.
Well. Honorable Asid Bekwin, at times it's better to one-on-one deal with the minister. So work with him. So let me take your last question.
I hope to state that in trying to collaborate with you, I should meet you in the office. Currently, if there are accident cases, you go and you find patients lying on the floor. Can the minister come in with some temporary measures to ameliorate the situation in Suhum?
Yes, Honorable Minister.
Mr. Speaker, I fully agree with the honourable member that the Suhum Government Hospital is at a very strategic position that serves anybody who plies on the road. And so, as I have already indicated, you should work closely with my office, and I can assure him that we are in to serve the country. We will do our best. Thank you.
Thank you very, very much. Honourable members, we will turn to question 263. 263. Honorable Member for New Juabe North, Honorable Nana Osei Eje.
Mr. Speaker, I stand on Order 883 with the express authority of Honorable Nana Osei Eje, and with your permission, to ask the Minister for Health the status of the Eastern Regional Hospital, which has been abandoned after 70% completion.
Yes, Honorable Akando, Minister. The way you are smiling, it means we are going to give a straight.
Mr. Speaker, the design, construction, and equipment of the Eastern Regional Hospital was awarded in May 2020, 5 years ago. The project made progress to attain a completion of about 57%. However, the project stalled due to the debt restructuring. The Speaker, as indicated earlier, the Ministry of Health, in collaboration with the Ministry of Finance, will consider resuming once the processes for the debt restructuring is concluded. So, Mr. Speaker, if the project was abandoned, it was abandoned long ago, but we will go back to site and do the needful. Thank you.
The way you were smiling, I thought you were coming to give different response. Yes, Honorable Member for Forukrum.
Mr. Speaker, no further questions.
Very well, thank you. So, Honorable Members, we turn to question 326. Honorable Dr. Thomas Winsome Anaba, a member for Garu. Doc, you have the floor now.
Thank you, Mr. Speaker. I rise to ask the Minister for Health the measures the ministry is taking to complete the Garu District Hospital.
Honorable Minister, Garu Hospital.
Mr. Speaker, I wish...
Honorable Member, may you put off your mic? Very well.
Mr. Speaker, I wish to inform this Honorable House that the Garu District Hospital project in the Upper East region forms part of the Agenda 111 initiative. The project had achieved an overall physical progress of 63% as of December 2024. Following government decision to rationalize the implementation framework of the Agenda 111 program, the Ministry of Finance, by a letter dated 13 February 2025, formally advised the Ministry of Health to incorporate all Agenda 111 projects into its annual budget proposal from 2025 onwards. Subsequently, His Excellency the President, through a directive dated 20th February 2025, instructed that the oversight and implementation of the Agenda 111 project be formally transferred to the Ministry of Health. In line with this directive, government commissioned an audit of all ongoing Agenda 111 sites, which is currently being undertaken by Measures Architectural and Engineering Services Limited, AESL. The ministry is presently awaiting the submission of AESL's final report and accompanying recommendations to inform the next course of action towards the continuation and completion of the Garu District Hospital project. Thank you.
Yes, Dr. Anaba, any further questions?
Mr. Speaker, thank you very much. Let me thank the Minister for his answer, but I would like to explain that the Garu District Hospital is very necessary to be completed simply because Garu has never had a district hospital. We used to patronize the Boku Hospital, but due to the conflict and crisis in Boku, we no longer have a hospital where we go to get sick health. That is why the government decided to put up the Garu District Hospital. And as it is told, most of the staff who were in the Boku Hospital have been moved to either Zebila, Binduri, Garu, or Timpani. But if you check around the Kosak area, out of the 6 districts, none of them has a district hospital. So we think that completing the Garu Hospital is very imperative to ensure that at least it caters for the other district or even help reduce the burden and pressure on the Boku Hospital if it resumes work. So I would like to plead with the minister to ensure that when they are considering hospitals to be completed, at least the Garo District Hospital should be part of those few hospitals. Thank you.
Thank you very much. This is not a question. So, Dr. Kabil, this is a constituency. This is not your constituency.
Mr. Speaker, the response from the minister goes beyond the specific constituency. And if the response of the minister is far and wide, it's only well and good that we are allowed to ask questions.
Let's hear you. Let's hear you.
Minister. Mr. Speaker, I would think that Garu was one of the few many districts without hospitals. And Nana Addo Dankwa Akufo-Addo vision to make sure that every district, and he mentioned that none of the districts in that particular enclave has a district hospital, but through the Agenda 111, all of them would have had district hospital. Mr. Speaker, the problem with Garu, I know Garu personally, and I know the specific hospital. Mr. Speaker, in fact, of all the hospitals in the Upper East region, Garu District Hospital is one of the hospitals that have gotten at least considerable percentage of work done. The work done on that particular hospital means that...
Doc, just ask the question. Just ask the question.
Mr. Speaker, I want to find out from the minister if this so-called audit, that this so-called audit that is to be done on the Agenda 111, you can wait for your statement to be made. Mr. Speaker, I'm being harassed. I will need your protection. Mr. Speaker, I want to find out from the minister. Public accounts is made to go and do your work. Mr. Speaker, I want to find out from the minister this so-called auditing by the auditor or forensic audit, whatever he terms it, on this particular Agenda 111. What is the goal of that auditing, and how soon are we going to get the audit being done? What's the goal? Because work is being done.
Honorable Kabilu, respectfully, you are changing the question entirely. I hate to do that, but if you are asking questions directly to Garu, fine. But now you are shifting to auditing and those kind of things.
Mr. Speaker, he mentioned in his response that they have engaged an auditing firm to do an audit of the projects. Agenda 111 project. I didn't introduce that, Mr. Speaker.
Honorable Minister, so he said, what's the intent of the audit? If you can tell us something.
Mr. Speaker, you take office and you have ongoing projects. You need to understand where the contractors have got into, how much has been paid, especially so when you don't have a dedicated source of funding for the project. And then as government, you strategize to see how you can get money to continue all these projects. So, Mr. Speaker, you must understand what you have inherited. That will inform your strategy for securing funding for the project. But, Mr. Speaker, let me assure this House that His Excellency the President has indicated time and again that he is not going to abandon any project he has inherited, ongoing project that he has inherited. And therefore, I can assure the House that we will tackle any project that we have inherited in due course. Thank you.
Thank you very much. We turn to question 492. Question, Dr. Anaba.
Mr. Speaker, thank you very much. Once this is a House of Records, I want to correct misinformation. Garu had a project from the NDC government in 2012 by NMS to build a hospital.
Honorable Doctor.
So to say that Garu never had a hospital, there was a project ongoing. Your government came and stalled it and put it in the infrastructure tracker that you are building a hospital in Garu, which was not true.
Honorable Dr. Anaba, respectfully.
Thank you.
Respectfully. Leader.
Actually, I was outside when I heard the follow-up question about Garu. I rushed in because I thought that there was some misrepresentation that needed to be corrected. And I think that is what the member for Garu is trying to do. The questionnaire actually mentioned Garu as a beneficiary of Agenda 111. But that's not the case. The Garu Hospital was started by the NDC 9 years ago, or even more. And then when the NPP took over, they stopped the project. So for 8 years, nothing happened there. Materials that were mobilized at site were all vandalized and stolen until NDC has come back. And so that is why he's asking the minister what is going to be done to complete that hospital, whether it will be prioritized. So when you do a follow-up question and then you present it as if Garu was a beneficiary of Agenda 111, I think that the record needs to be corrected, that Garu was not a beneficiary of Agenda 111. Boku was not a beneficiary of Agenda 111. I have not seen Agenda 111 in Pusga. I have not seen one. I only know that because the NPP won Binduri constituency, that is the only place that was assigned an Agenda 111 hospital.
Leader.
The rest didn't get any Agenda 111 hospital.
Leader. Leader, I think
Mr. Speaker, Mr. Speaker, Mr. Speaker, I think the majority leader didn't get the right briefing, because if you look at page 7. Response from the minister on the question 326. The minister admitted that it is an Agenda 111 project. But that's what the answer. The minister said. The minister said, Mr. Speaker, I wish to inform this honourable House that the Garu District Hospital project in the Upper East region form part of the government flagship Agenda 111 initiative.
And he himself admitted. He himself said it's Agenda. Honorable members, please. 5
kilometers.
10 kilometers. No, what are they benefiting from big push? Yes, suspend. They are big push.
Whose microphone is on, please?
Okay, so Mr. Speaker, if the NPP government decided to adopt that project, please, let's listen to each other. Please, let's listen to each other. The minister is sitting here. I know the hospital. The member of parliament is sitting here. He knows the hospital. And the minister's records will show that this is a hospital project that was started under the NDC. It was stopped by the NPP. Then after COVID, when MPP decided to do Agenda 111, they may have added Garu, but nothing was done there. Nothing was done there.
I had been there.
I'm saying that you took all Agenda 111 hospitals. When the president announced Agenda 111 hospitals, they were supposed to be new hospitals to be constructed. we all listened to him during the COVID when he announced it, that the government was going to construct new hospitals from the scratch. When you decided to adopt the hospital at Garu, then you had moved from your original objective and the Agenda 111. And I'm saying that I would have been happy if after adopting it, you had actually completed the hospital. But even after adopting it, you failed to complete the adopted hospital.
Leader, thank you. But I think if there's any confusion, probably it might have emanated from the minister's response that it was part of the Agenda 111 hospital. So,
Mr. Speaker, you see, don't be too diplomatic with the majority leader. You see,
am I being diplomatic to you?
You are being too diplomatic with the majority leader. The minister is seated there. Mr. Speaker, before even the majority leader walked in here, the questioner had admitted that apart from Garu, all others had district hospitals. By then, the majority leader wasn't here. And if you look at the question, Mr. Speaker, the minister admitted clearly that this is an Agenda 111 hospital. But unfortunately, minister, for some reasons, decided to allow the majority leader to consume him. You see, you don't do this. You don't do that, Mr. Minister. You are in charge. The ministry is in your hands. It is just the chamber that is in the hands of the majority leader. Don't let him bully you. This is an Agenda 111 hospital.
Thank you.
Mr. Speaker, 63% of the project is done. 63. You have admitted. No, I'm not debating. I don't want, you see, you are my friend. I don't want the majority leader to consume you.
Thank you.
Don't allow yourself.
Thank you, Honorable
Let the record reflect that it is an Agenda 111 hospital.
Thank you very much.
It is not. Thank you, Right Honorable Speaker.
Honorable, thank you very much. We will now turn to question 492. Question 492 from Garu. Let's come down to Ejuso. Honorable Member for Ejuso, Honorable Kabrabo-Ating.
Thank you, Mr. Speaker. Mr. Speaker, respectfully, I'm on my feet to ask the Minister for Health whether there's any plan on paper by government to establish a nursing training college in the Ejuso municipality. Thank you.
Yes, Honorable Minister.
Mr. Speaker, I thank the Honourable Member for the question. The Ministry of Health recognizes the importance of expanding training opportunities to meet the increasing demand for skilled nurses and midwives. However, at present, there is no official plan or approved documentation for the establishment of a nursing and midwifery training college in the Ejuso municipality. Mr. Speaker, the ministry currently oversees 94 nursing and midwifery training colleges across the country, 14 of which are located in the Ashanti region. Before any institution is established, the ministry, through the Human Resource for the Development Directorate, conduct a comprehensive needs assessment and feasibility study. These assessments take into account regional equity, availability of clinical training sites, financial and staffing considerations, and the accreditation requirement of the Nursing and Midwifery Council and the Ghana Tertiary Education Commission. Mr. Speaker, while the ministry has received expression of interest from the stakeholders within the Ejuso municipality, no formal proposal has yet been submitted or approved through the ministry's internal processes. That said, the ministry remains open to collaboration with metropolitan, municipal, and district assemblies, as well as development partners, to explore the establishment of additional training institutions in underserved areas as the need arises, particularly for post-basic and specialist training programs. Thank you.
Yes, Honorable Kabrabo-Ating.
Mr. Speaker, thank you. Yes, Mr. Speaker, by way of laying basis for my next question, I would like to say that the Ejuso municipality It's a youthful population. The size is about 74,000. Mr. Speaker, we have about 8 senior high schools churning out graduates, of which some of them may want to pursue a career in nursing. The municipality is also an urban one, hosting about 46 major towns. 2024 projection, population projection is about 196,000. Mr. Speaker, I would want to find out from the minister if these are not necessary imperatives which may warrant, Mr. Speaker, an establishment of a nursing training in the municipality, looking at, Mr. Speaker, the indices that I have enumerated. Thank you.
Minister, have you heard the imperatives? Very, very necessary ones.
Mr. Speaker, all the factors he has enumerated are all very necessary requirements. Thank you.
Minister, I didn't get your answer well. Yes.
Mr. Speaker, the questioner only
your
asked,
friend, though, so
yes, the questioner only asked whether or not the factors he has enumerated are not necessary imperative for the establishment of a nursing training college. Is that not my question?
Yes.
Is that not the question I'm supposed to answer? I say yes, they are.
So you are going to give establish one?
Mr. Speaker, are you asking the question for him? There was a very simple question I'm supposed to respond to.
Yes.
He didn't add that. Did he? He didn't add that. So, Mr. Speaker, I will read some portions of my response. I'll repeat them. That the ministry remains open to collaborate with metropolitan, municipal, and district assemblies, as well as development partners, to explore the establishment of additional training institutions, especially in underserved communities. So, Mr. Speaker, we can take it from there. We will link up, and then we will take the conversation from there.
Thank you. Yes, Honorable, do you still wish to?
Yes, Mr. Speaker, my last question may be, and Mr. Speaker, permit me to lay the basis. I'm rightly informed that papers have been sent to the ministry, as the minister also rightly indicated that there's been some proposals. Mr. Speaker, I may want to know that if a formal proposal, one which the minister will rightly deem, befitting a proposal, how long will it take for steps to be taken to consider setting up a nursing training in the municipality?
Honourable Member, see, at times we have to. In this house, at times it's better to see the minister one-on-one. You've laid the basis. I will ask you to deal with the minister personally. That may yield the needed results. So after laying the basis, I will urge you to try to see the minister and discuss the matter over here.
Very well, Mr. Speaker, I take a cue.
Very well. So, honorable members, let's take the last question. Let's take the last question from Honorable Member for Hemain Lower Denchura, Honorable Lawrence Ajin-Sam. Honorable Member, you take the last slot.
Thank you, Mr. Speaker. I rise to ask the Minister for Health the plans of the ministry to furnish the Chufu Hemain Lower Denchura District Health Directorate with an administration block and staff bungalows to operate effectively and efficiently. Thank you.
Thank you very much, Honorable Minister.
Mr. Speaker, the ministry acknowledges the importance of providing a conducive working environment and adequate residential accommodation to enhance the effective and efficient operations of the Chifuhiman Lower Dentra District Health Directorate. As part of the ongoing health sector reforms, the construction of office and auxiliary facilities at the district level has been decentralized and now falls under the purview of the respective district assemblies. The ministry will, however, collaborate closely with the Ministry of Local Government, Chieftaincy and Religious Affairs, as well as the district assembly, to ensure that appropriate office and residential accommodation are provided to facilitate the effective performance of health staff within the district.
Yes, Honorable Ajinsani, any further questions?
Thank you, Mr. Speaker. Mr. Speaker, I would want to do a follow-up by asking the Minister, per his answer, that the construction of office and ancillary facilities has been decentralized. When was it decentralized? And then what are the steps that I need to take to be able to engage the district assembly so that Chifuhiman Lower Dentra would have the needed office?
Yes, Honorable Minister. Honorable Sunyani Bruni, Sunyani JJ, may you put off here? Yes.
Mr. Speaker, as far as I can recall, for the past 8 to 9 years, the Ministry of Health has not constructed district health directorate offices in the country. It has always been part of the project by the district assemblies. So when they do the constructions, then we will fill in the staff. Thank you.
Yes, Honorable.
My last question. If indeed the Minister says that it has to be done by the district assembly, my follow-up question is, what about logistics, computers, and other things that need to be provided to the health directorate? Is it also to be provided by the assemblies or by the ministries?
Yes, Honorable Minister.
Mr. Speaker, as the directorate fall under the ministry, as and when they need the assistance, they have the right to write to the ministry or the Director General of Ghana Health Service, and we'll look at it and consider it accordingly.
Thank you very much. Honorable members, on behalf of the House, let me thank the Minister for attending upon the House to respond to members on issues relating to health in their constituencies. Honorable Minister, we thank you and you are hereby discharged. Leadership. We are on statement.
Mr. Speaker, I think we have 2 statements.
I only have one.
Yeah, we can do one and then.
I only have one, and that statement, on Friday, I decided to take the statement today. That is in respect of Ghana cedi as 60. I think today the Bank of Ghana celebrated and launched it. So I think it will be appropriate. I asked the chairman